The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
Unprecedented levels of COVID-19 are leaving no part of this province untouched. Tonight, how Peel Region, Niagara, and Sudbury are responding. Then, an update on Laurentian University from our Ontario hubs. And from understanding Omicron to exposing QAnon, we've got the Agenda's Week in Review. It's Friday, January 7th, and that's ahead on the agenda. The Omicron variant of COVID-19 has swept across Ontario as no previous strain has. It's truly put pressure on everyone, including public health units who've already been overworked for going on 2 years now. Here to tell us how the regions are confronting the new variant. In Sudbury, Ontario, Dr. Penny Sutcliffe, Medical Officer of Health and Chief Executive Officer for Public Health Sudbury and Districts. In Thorold, Ontario, near St. Catharines, Dr. Mustafa Hirji, Acting Medical Officer of Health and Commissioner for Niagara Region Public Health and Emergency Services. And in the provincial capital, Dr. Lawrence Lowe, Medical Officer of Health for Peel Region. Hi to all of you.
Hello.
Yes.
Hello.
Thank you so much for making time for us. I know you're incredibly busy, and to have the three of you on the show, it's such an honor for us. Dr. Sutcliffe, I wanted to start with you, and I want to ask this question to all three of you. The province returned to a modified version of stage 2 earlier this week. What impact do you hope this will have in terms of stopping the spread of Omicron? Dr. Sutcliffe.
Well, actually in our area, we started experiencing a surge with the Delta variant in early November. So in fact, we look to the measures similar to a modified stage 2 in early December. And with the Delta variant, we were seeing a decrease in cases. So that was very encouraging. Then, of course, Omicron entered into our community in Sudbury, Manitoulin districts, and we've seen quite a surge. My hope, however, is that given that our population is used to these measures now from early December, that we will continue with them, decreasing contacts, giving us an opportunity to really get more booster doses in people's arms and protect, in particular, the most vulnerable. So decreasing contacts, really making sure that we dig deep again, and everybody's very tired, as I'm sure all listeners are aware and feeling the same way, but knowing that this is an acute situation that requires extraordinary measures and really should help us to do our full extent possible to decrease the contacts and further protect people.
And Dr. Hirji?
Yeah, as Dr. Sutcliffe says, we're dealing with a very difficult time right now with the Omicron variant. And just the nature of this variant is it spreads so easily, so quickly, that unfortunately I don't think these measures are going to stop the spread the way previous lockdowns might have. What this is going to do, though, is it's going to slow down the spread and buy us more time to get those booster doses out to people and really put in place some additional measures to keep essential places like schools open. And that's really what the name of the game is. But coupled with those measures, I think it's really important that we all personally do the things that we can do to make sure we stay safe and limit the spread as well, which is really limiting our social contacts, staying home as much as possible, making sure we're wearing those masks really diligently, keeping physical distance from others. And if we do that, we'll make sure we keep ourselves safe until we can get our booster doses, and we'll slow the spread in the community as a whole, making sure everybody else stays safe until they can also get their booster doses.
And Dr. Lowe?
The reality is my colleagues have highlighted the fact that we are now in a different phase of the pandemic response. And this is really a little bit of a transition to some degree because Omicron has required that. Omicron has spread further and faster than any variant that we've seen. And the reality is that some of the other measures that we used previously are not going to necessarily have the same overall impacts as we did in the past. So it really behooves us now to start shifting our approach to making sure that we are protecting our highest risk settings, hospitals, long-term care, congregate living settings, etc., but also really that individuals take the steps that they can during this surge to make sure that they're staying safe. And that means things like getting vaccinated with 2 doses. That means getting a booster if you're older. That means getting your kids 5 to 11 vaccinated so that when school reopens, as they should, hopefully in short order, they can also have additional peace of mind, and also making sure at least during the storm, you're continuing to limit contacts, wear your mask when you're out and about in public, and really keeping yourself and your family and your community safe.
You've all mentioned different phases of this pandemic. Dr. Sutcliffe mentioned that people are really tired. And Dr. Hirji, you mentioned that these measures that we have right now in this modified stage 2 are not going to be able to, I guess, achieve what could have been achieved if this was the Delta variant. Dr. Hirji, should the province have brought in these restrictions much sooner?
I think they probably should have. These Ontario Science Table called for a circuit breaker measures really for December 15th. And unfortunately, it was delayed, which I think has put us behind the 8 ball a little bit at this point. Past is past. We have to deal with the situation we're in right now. It's good we finally have these measures in place, which are going to start to help slow the spread and make sure that we don't see huge surges that overwhelm our systems in our hospitals. We need to make sure, as we were saying earlier, though, now we use this time to make sure we get those booster doses, we get our kids vaccinated, and we take those steps that we can take in our personal lives to make sure we stay safe until we're past this Omicron wave and starting to enter that next phase of this pandemic, which will hopefully be very close to the end of it.
And Dr. Sutcliffe, part of your many different responsibilities in your position is communicating this information to people. We just finished the holidays. People are, I think, we expected a little different start to 2022. How do you approach communicating all these different changes when some of the pieces, you don't really know where they're going to end up landing?
I think that's a really good question. So yes, I'm the medical officer of health and CEO for my region, but I also live in my region and experience all the same frustrations that all of our citizens do. So certainly making sure that we're conveying the empathy and the understanding of how difficult this is and the sacrifices that everybody has had to make. For sure, our healthcare workers, our public health staff, but everyday citizens, business owners, parents, etc. So making sure that we are trying to communicate as transparently as possible. This is not news that anybody wanted to hear before the holidays or after the holidays with regards to the additional shutdown measures, as well as the schools transitioning to virtual learning. Nobody wanted this, but this is what we are living with right now. So making sure also that people are aware of what it is that they can do. So not only telling people what they can't do right now, but what they can do. So be that virtual gatherings, be that ways to keep your family safe, all the measures that have been mentioned by my colleagues, vaccination obviously very critical. And for people really to understand that this is about all of us individually, but also about all of us collectively, so that we are, the concept of protecting our healthcare system is actually made personal, that we understand that should I or my neighbor need to visit the emergency department, that our staff at the hospitals are there for us. So really understanding the sacrifices that we are making, but also seeing the light at the end of the tunnel, which I think our colleagues are also communicating with regards to the transition phase that we dearly hope that we're in right now and transitioning to brighter days ahead.
And Dr. Lowe, I saw you nodding your head.
Yeah, I think the really important thing for folks to remember is that we are in a different situation and context. I've heard a lot of folks say, well, this feels like March 2020 over again. Nothing could be further from the truth. We have a different context with a highly vaccinated population. We also have a totally different variant that is extremely transmissible, that is really changing the way that we approach and the way that we are tackling this pandemic response. So I encourage everyone, really, there is a lot of hope with our current situation as well, because there are things we can do to see ourselves safely through to the other side. Getting vaccinated with 2 doses if you haven't been vaccinated, getting your kids vaccinated, getting vaccinated with 3, making sure, like a snowstorm coming out there, we know that if you can just stay off the roads and keep it open for those who essentially need to be out there, for first responders, etc., that'll help to keep everybody safe. Thinking about our frontline workers and people that can't work from home, and certainly our healthcare workers and the impacts that reducing contacts will have, where our hospitals just really need to get over the hump through this difficult time until we're on the other side, where this is essentially burned through, and ensuring that we are all taking steps, not just to protect ourselves, but to protect the highest risk people in our community.
And Dr. Hirji, Dr. Lowe mentioned March 2020, and a lot of us feel like as if we're back in March 2020 with having to learn online, different places being closed. But throughout this pandemic, one of the messages that we've been getting, stay at home, get vaccinated because we don't want to overwhelm our hospital system. How bad is it in terms of hospitalizations and deaths right now, Dr. Hirji?
Yeah, so as Dr. Lowe was stating, there's some elements that maybe are similar to March 2020. Obviously, the surge of cases, obviously the importance of us breaking up our social contacts. But you also just mentioned vaccination, and we did not have vaccines in March of 2020. We also have new medications, including some perhaps new ones that may be very soon approved. That's going to be a real game changer. And when I look at our community, and back in March of 2020, we saw long-term care homes very badly hit. We saw lots of illness and tragically many deaths there. And one of the things that I'm seeing here is that over the last 2 years, because we've learned so much about COVID-19 and how to control it, we're sadly seeing outbreaks in long-term care homes, but at least in my region, they're much smaller, and we're not seeing people dying in those outbreaks. And that's thanks, I think, principally to that vaccine is really protecting people, but also we learned so much about how to protect these people and how to make sure things are safe. And I think those same lessons then factor into what we're all going to do in society as a whole. We've learned all kinds of things about how to keep ourselves safer. Yes, keeping 2 meters distance, even more distance as possible is important, but we know about how masks are important. Wearing a well-fitting mask that properly covers the face, nose, mouth, and makes a good seal and is 3 layers, that's really important. We know about the value of ventilation, and if we know being in a closed space that's small, that's going to put us higher risk, and we can avoid that. There's lots of things I think we've learned, which makes this very different than March of 2020, and I think gives me a lot of optimism that we can get through this much more safely than maybe previous waves have been. We just need to make sure we do those things to make sure we stay safe.
I am guessing that neither 3 of you have had a chance to really have much of a break. And we've been hearing a lot about staff shortages within the hospital system. Dr. Sutcliffe, how bad are staff shortages?
I think it's a really good question, and this is all relative. So I work in an area that includes the city of Greater Sudbury, but many other really small municipalities with small healthcare systems and limited health human resources. And so it doesn't take much for our small communities to go down and to really feel the impact from a healthcare perspective. So it is the numbers of cases, the numbers of contacts, the staff that need to be off, but it's also our baseline capacity. It does not take much in the north to tip the balance, wherein we are facing challenges in managing acute or serious health situations. Yeah, our hospital is a regional hospital. The numbers of admissions are going up, are increasing. And as we know, this is the case across the province. So it will be very difficult to look to other health centers to assist us in the north. So certainly within our public health system in the north, we're also concerned about the health human resources. We have mission critical right now about getting vaccinations in arms, and we are the lead agency doing that with our public health nurses and other staff. So we're monitoring that very, very carefully and making contingency plans to make sure we can continue to do this critical work within the public health workforce also.
And Dr. Lowe, in your region this past week, you had a code orange, and it's since been declared over. How worried are you that the hospital system won't collapse?
Well, I know our healthcare partners, our hospital partners within the region of Peel have made heroic efforts throughout. I'm sure they will continue to find innovative ways to weather this tremendous storm that's coming through. But it's really important to speak about the idea of staff absenteeisms as a whole and really point to the fact that this does reflect the very difficult transition period that we're going through. We have a highly vaccinated population, but we have a new variant that transmits much more easily and a high absolute number of individuals who remain unvaccinated. And it is that large pool of individuals who remain unvaccinated that are both driving healthcare demand and also driving the isolation policies needed to protect them. That also drives a lot of the absenteeism, not just in the healthcare system, but as Dr. Sutcliffe alluded to as well, even for us in public health units, where we are trying to get vaccinations out as quickly as possible, where our staff have also been on the front lines of this thing for the last 2 years. We're also contending with those same shortages because of the isolation protocols that are in place to protect those who remain unvaccinated at this time.
Vaccine mandates seem to still be something that the government is not, I guess, because it's pushed back and some people don't want to be forced to get a vaccine. And Dr. Hirji, in your region, Niagara Health recently paused its mandatory vaccination policy for staff. How come?
Yeah, so that's actually a decision by our hospital sector that they're pulling back on their mandatory vaccine policy for their staff. Obviously, the province chose not to bring one in place, so our hospital system chose to do it themselves to make sure they maximize patient safety. I think it'd be best to speak to them about what's happening, but I think it is a reflection of just the sheer number of staff illnesses that they have, that they feel that they need to pull on any staff person they can possibly bring into the workforce. But I would really have to defer to them to speak more about this.
But because I think there's a lot of people who are watching this, and they might be vaccinated and might be nervous coming to the hospital because there's a possibility that the person treating them isn't vaccinated. What would you say to those people, Dr. Hirji?
I think we should have some level of concern really anywhere we are around other people, because there's always going to be the risk of infection spreading, which is why we're really all emphasizing in the message here that we should limit our social contacts, really avoid being out of our home unless it's for essential purposes. Obviously, if you need healthcare, you absolutely do need to go to a hospital. You definitely should go. It's important for your health at that point. And our hospitals are taking every precaution that they can. They're going to be wearing good quality personal protective equipment. They are going to be, having high levels of disinfection. They're going to be practicing all the measures to hopefully keep you safe. And so I would say if you need to go to the hospital, absolutely go to the hospital. But in general, of course, you want to avoid being around others because there's never a zero risk scenario.
This conversation around people not being vaccinated is really, I think, multi-layered. There are many reasons why people might not be vaccinated. It could be access, it could be time. I know personally trying to get my own vaccines, I've likened it to the Hunger Games. A lot of people have, and I'm sure it's challenging for people who do want to get vaccinated, but might not have access to get to the vaccine. Dr. Sutcliffe, I wanted to ask this question to all three of you, but I want to start with you. What are some of the challenges have you faced in making vaccines accessible in your communities?
It's a really good question. And from a northern perspective, with the rural remote communities we have, I think that is one of the issues. Certainly, as winter is upon us, traveling the winter roads, our furthest community is at least a 5-hour drive away on a good day. We have challenges in that we don't have economies of scale. So we have to do the same work in providing vaccines, so staff, the transportation issues, the quality control, et cetera, no matter where we are. And sometimes we celebrate, going to all of those efforts and perhaps getting 10 doses in people's arms. So I think that there are issues related to access that, and with the limited health human resources. So trying to make sure we do that. We've worked really closely with area First Nations and urban Indigenous health providers to make sure that there are culturally appropriate and accessible opportunities for members of those communities to be immunized. We have worked really closely with those who are working with underhoused and populations who are homeless to make sure that there are pop-up opportunities and mobile opportunities. All of these are a great amount of effort, but we celebrate really every dose that we get into people's arms. Access absolutely is an issue. Transportation, trying to make sure that even within the city of Greater Sudbury that isn't a barrier, but certainly throughout our districts with the vast geography that we have, to make sure that those opportunities are there for people. So absolutely top of mind about access and about sharing credible, reliable information about vaccine safety and the vaccine effectiveness.
And Dr. Lowe, we know Peel Region at one point didn't have access to vaccines where people wanted to get vaccinated. What are some of the challenges that you have faced in making vaccines accessible in your community?
Yeah, I think this is the fundamental work of local public health, and so you'll hear differences in my answer in respect of Penny's, but this is Dr. Sutcliffe's rather. But this is the essential work of local public health and knowing our community and what we need to get out there. And I would actually respond. We did have access, if anything, in Peel for vaccines for our residents where they needed them through the first and second. With community agencies, our pop-ups were very much focused on specific religious and cultural groups that couldn't attend attend at mass vaccination sites. Even with our mass vaccination sites, we worked with community ambassadors in our diverse communities to set up booking and transportation links to ensure that people could get vaccinated. All of that infrastructure is still in play at this point in time. We face obviously a very different challenge right now because 1 million people became available, eligible for boosters literally overnight with the provincial government decision in mid-December. So we continue to work with our community ambassadors. We continue to work with community agencies, particularly trying to focus on our 50 plus and also our 5 to 11s. But it is about, and it has always been that slog in our community about building trust with different community groups, with diverse community groups that for very good reasons have historic mistrust of institutions, of government, of healthcare, and helping them understand that accessing vaccination is their best protection while providing that access in the places where they live, work, and play.
Dr. Hirji?
Yeah, Niagara region is probably a bit of a cross between a very large urban area like Peel region and a very remote rural region. I shouldn't say perhaps very remote, but a more remote rural region like Sudbury, where, we have some smaller cities. The largest one, St. Catharines, is maybe 120,000. We have 12 municipalities, some very rural, with under just a few thousand people. And so, like both of them, we're using several of the same strategies, engaging with those, key cultural groups, immigrant groups, to make sure we get access to people who may not have access and may have less trust in the healthcare system or have language barriers and the like. We're also working on having all kinds of pop-up clinics and very localized vaccine opportunities to people who may be living in an area far from a larger center where there would be more access to vaccinations or pharmacies and the like. And then we, of course, have some unique circumstances, such as, we're a big agricultural region. We are, I think, we're the second or third largest area of Ontario in terms of migrant agricultural workers. And we, of course, want to make sure they're all protected and providing food for us. And, of course, being a part of our community as well. One of the big challenges in terms of delivering vaccination right now is that many of our healthcare partners are very stretched. We've talked about hospitals and they're very stretched. And so they're not able to play as much of a role in delivering vaccinations right now. And just generally, 2 years into a pandemic, our staff are feeling some burnout. We have seen some attrition of our staff, so we're not as well staffed as we have been in past waves. As well, some of our staff may be working part-time for us, part-time in a long-term care home in a hospital. And those hospitals and long-term care homes are in desperate need of staff. And so we're not able to have those staff supporting us as much. And of course, our staff work in the community. They are sadly sometimes contacts of a case of infection, or they have to actually are sick with COVID-19 and have to isolate. And so that makes our staffing very unpredictable. And so that's a challenge that we are grappling with really on a daily basis to figure out how many people do we have that we can bring in the office today? How many doses can we deliver while making sure that we can keep people who might be infectious away from these clinics so we are not infecting people when they come to our clinics. It's a real challenge to actually balance all of that right now.
I can only imagine what the last 2 years have been like for you all in front of the cameras. A lot of people are looking for you for leadership, for guidance, to keep calm in the storm. Before we look forward, can you reflect on the last 2 years and what they've been like for you? I'll start with you, Dr. Sutcliffe.
So it has been a real, honor and privilege to be in this role as we are leading our communities through this pandemic. And I'd like to pick up on something that Dr. Lowe said, and that is the work of local public health. And so I can't just speak about me or public health, but the multiple connections that we have, the network throughout our communities. This could not have been, is not being done alone by any stretch. Public health has a significant leadership role, and I congratulate our public health heroes every day. And it is really through the networks and the relationships that we have established over the years, be it with local municipalities, with police, with school boards, with grocery store owners. We're part in the fabric of this community. And so together we are leading and getting through this pandemic and supporting one another through the very difficult times. I don't think any of us would say that this has been an easy ride. The roller coaster, the drinking from the fire hose with all of the changes that we've all been experiencing, but that local public health has a responsibility to translate and to make meaningful and actionable in our local community. So it has been a privilege. It's one of those things where I perhaps wouldn't wanted to not have had it because of all the learning and the growth. However, it would sure be great to get a few moments of our lives back, there's no doubt, and with our families that have been supporting us tremendously through all of this.
And Dr. Lowe?
I honestly think the last 2 years have saved a lot of lives and actually made a lot of difference for people who might otherwise have faced mortal or severely disabling outcomes with this novel disease. I think our communities coming together really made a difference in terms of keeping each other safe. And I have been most heartened by how resilient and collective action by our community agencies, all of our community partners, the folks that Dr. Sutcliffe was speaking to, the same exists here with our local public health unit in Peel, has really made a difference in mitigating and reducing the potential impacts of this novel disease. I agree that it hasn't been, easy, and certainly there have been many uncharitable or abusive remarks that have come my own way, but I know it comes from a place of fear. And I think the one thing I would leave people with is, even as we look backwards, we know that we've made a difference. We know that we've done the very best we could in Canada, I think, with the context that we were given and the cards that we were dealt. And what we can really need to focus on now in the midst of this Omicron surge is looking forward. What are the things we can do to get through this and to really rebuild as we finish this transition from acute pandemic, hopefully, into something a bit brighter in this year.
And Dr. Hirji, Dr. Lowe mentioned some of the pushback he's received, some of the hate, because you have become public faces. You've had people show up to your home protesting. When you reflect on how the last 2 years have been, how would you describe them?
Yeah, as much as there's been that adversity, and certainly as a member of the community, it's difficult to live through a pandemic. The thing that I really have, cherished about this is the opportunity to work with the incredible people here in our organization in public health. There are so many people who've really stepped up and showed incredible dedication and commitment to supporting our residents. And as Dr. Lowe said, have really literally saved lives here. And as we tried to add additional staff, we hired a lot of really young, new professionals, and they've been really, truly outstanding people. And, looking forward, I think as a community, we've also learned a lot about some of the, risks in our community. We've learned about the real risks that people who are of, racialized backgrounds or more poor backgrounds or marginalized backgrounds have suffered, and how they've disproportionately been impacted by COVID-19 and had less access to vaccinations, as I was talking about a moment ago. And one of the hopes I think we'll hopefully take away from this pandemic is that we've learned from that, and we'll be able to take steps moving forward as a community that, with this greater understanding of these risks, we can hopefully do something to really improve their stock so that we can actually make a more equitable society going forward, and a society that's more resilient to any future health threats that come forward. And I hope we make reinvestments across our health sector, our social sector, and public health to make sure that we can achieve that.
I want to thank all three of you on behalf of all Ontarians for working so hard to keep our communities safe. We really do appreciate all the hard work that you've been doing. Thank you so much.
Thank you.
Thanks, and all the best for 2022.
Thank you.
Laurentian University entered creditor protection last February. It raised a lot of questions, and so far, for those asking them, it's been tough to get answers. Here to explain from Sudbury, Nick Dunne, who covers the Northeast for Ontario Hub. Say, Nick.
Hi, Jan.
All right, so it's been nearly a year, so I'm hoping you can refresh our memory about how Laurentian got into this predicament.
Right. Well, Laurentian had been operating on some deficits for quite a few years, and it had also gone on a big capital spending spree back around 2010. I mean, we don't know the entirety of the situation, which is what we're trying to find out right now. But effectively in February, they went into insolvency proceedings under the Creditor Protection Act. And, since then, we've seen around 70 programs cut. We've seen about 100 faculty and staff laid off. And since then, we've seen about a 30% drop in first year enrollment. So that's kind of where we're at with Laurentian right now.
Now, the Auditor General's office is trying to get to the bottom of these troubles. How are they exactly doing that?
Right. So at the end of April, the legislature requested the Office of the Auditor General to conduct a value for money audit. This audit is to look at the finances of the university for the past 10 years to figure out two things. First of all, how did Laurentian go insolvent? And two, what can we learn from Laurentian's situation to avoid this in the future for other universities? And this has been ongoing since May, but unfortunately for the Auditor General, this has been a very difficult process because the university is under certain confidentiality orders during the creditor protection process. So there's some competing interests between what the Auditor General is trying to do and what the university says it can properly send over to the Auditor General for this audit.
For your article for TVO.org, you wrote about speaker's warrant. What exactly is that, and how much power does that have?
Right. So the speaker's warrant is a legislative tool, very rarely used. The last time was around 2012 for the Ontario legislature anyway. That it effectively is a warrant granted by the legislature, similar to a court warrant. This compels whoever's been handed this warrant to appear before the legislature or provide certain documents. This was issued because the Auditor General has really struggled to get a lot of information from Laurentian because of this confidentiality issue and solicitor-client privilege. So the legislature, in assisting the Auditor General, has submitted this speaker's warrant to try to compel the university to hand over this information.
Now, Bonnie Lysyk, Auditor General for Ontario, has come out and sort of said, the reasons why this is necessary. What did she tell you?
Right. So this is a significant public institution, Laurentian University. It's received at least well over $80 million a year for on average for several years now. So, going back to Laurentian's existence, this is, like hundreds of millions of dollars. It has had a significant impact on the region, and as a broader public sector institution, it is of great concern to the public and to the to Queen's Park that this has kind of unfolded, that an institution has gone insolvent. So figuring out precisely what happened and how public funds were used is important, as is potentially protecting these other institutions. The other problem, why this has become necessary, the Auditor General going to court on top of the speaker's warrant itself over certain documents, is she mentions that the fact is that many of the documents that they're looking for, or sets of documents, say a whole set of emails from a former president, that contains a lot of non-privileged information and privileged information. So often these sets of documents or emails or files are kind of all mixed together. So it's been a challenge getting a hold of some non-privileged information because it is mixed with that apparently privileged information. So that's what the Auditor General has said as far as the primary challenges with this audit so far.
Do we know why Laurentian University is refusing to turn over those documents? Is it because it's just mixed up with a tangle of privileged and unprivileged sort of documents?
Right. So Laurentian is claiming client solicitor privilege for a lot of these documents, and they're also bound to confidentiality due to the creditor protection process. This is a court mandated situation. So they do run the risk of being in contempt of court by just disclosing this confidential information as the creditor protection process is underway. So again, as I mentioned, it's two very competing interests between the Auditor General's function and giving the public information on how this happened, why it happened, what kind of mistakes were made financially, and the confidentiality and the effective continuation of this insolvency proceeding that Laurentian is under.
All right, so let's talk about sort of the next steps. I don't imagine, OPP is going to be barging into the university to get these documents, but I imagine there are some dates that the university has to comply with. So what are sort of the next sort of steps there?
Right. Yeah. A fun little fact there is the last time someone's been imprisoned by a speaker's warrant was, I believe, in 1916, and that was under the federal legislature. So it's been a very, very long time since any kind of significant arrests or imprisonment or police action has been involved here. But the speaker's warrant compelled Laurentian to hand over their requested information by February 2nd. However, on December 23rd, Laurentian filed a motion to put a stay on the speaker's warrant. So they're going to the courts to see if this can be suspended until the courts figure out a few key matters involving parliamentary privilege and its limits, whether or not the Auditor General has the authority to compel this information, whether the courts even have any kind of jurisdiction in this matter. So there are a few things that kind of have to get sorted out. The motion will be heard on January 18th, I believe. So we'll have to see what happens there in the coming weeks as far as the warrant goes for February 2nd. But these matters are often settled. The battle lines are drawn between the school or whatever institution and the legislature, and they eventually kind of sort out, what does the legislature need? What are the needs of the other institution or individual? So, there are a number of ways that this can play out. But I think the next key date to see is January 18.
Now, we should mention, while this is kind of happening in the background, school is still going on at Laurentian. Curious, how are things at the university now for students and faculty?
Mm-hmm. Well, I don't know how much the speaker's warrant is affecting the day-to-day life of students, faculty, the community in Northeastern Ontario, or even the higher education sector more broadly. But this Auditor General's audit is a pretty significant deal. As I mentioned, we're talking about hundreds of millions of dollars given over the decades. We're talking about so almost 70 programs being cut as a result of this. So understanding exactly why this happened, how this happened, who is responsible for what, is of major interest to the people who've been affected by this. This is the first insolvency that's ever occurred for a public institution like a university, rather. So I think there are many questions about how exactly we got to this point, given the fact that, there are annual financial statements that the university has to make and that there are various checks and balances. So I think a lot of people are very concerned about what happened. They want to know why it happened, and they would like probably some accountability as to who is responsible for what and how we move forward.
A lot of questions to be answered and some key dates to keep our eyes on. Thanks for the update, Nick.
Thanks, Jan.
The agenda this week checked in on Omicron, QAnon, and to begin our week in review, the return to online learning this week.
We entered this pandemic in a time of relative peace. We're not in civil conflict. We don't have civil war. We are relatively peaceful. We have one of the largest bureaucracies comparatively in the world. And what that means is we have an administrative structure that is well developed. It is really difficult to understand how, when we have those conditions, we are now in the third year of academic disruption without a plan. It's one thing to say, oh, we didn't really see it coming in March of 2020, although people who study pandemics and global health would have said that actually we should have been more prepared. Well, fine, let's say that was the case. We're now in January 22. We have access to a host of other technologies that just weren't available, vaccines, rapid tests. I mean, in theory, they're all there. And we have within our country the systems to be able to plan. So what we end up seeing is this ad hoc policy on the fly for education in Ontario in particular. This province has the largest cohort of elementary and secondary school students, and yet we've had the longest school closures. And we don't start at 0. We start at 26 because we've already had 26 weeks of school closures since March of 2020, compared to Quebec, for example, which had 10 or 11 weeks. And so when now we have an extra 2 weeks, you need to understand that those closures, the effects of those closures are cumulative. So we have to start at 28 weeks. Every time there is an extended closure, we have to add it on to the additional, to the existing closures that were already there.
Prachi, you mentioned curriculum. We're going to come back to that in a few moments. But Annie, Prachi said this was a predictable outcome and it could have been prevented. And even with the 2 weeks that we've been given, a lot of people are asking questions. What's going to be done in those 2 weeks to make schools safer for teachers, for students, for everybody? In your view, what should the government have done that they didn't do in order to keep schools open?
Well, and I think it's not just safer, right? Yes, safer, but also with all of the appropriate supports in terms of ensuring that kids are able to recover and, thrive and move forward. And I think that Prachi brings up an incredibly important point about the lack of planning. It's been kind of extraordinary that there's been no plan. So even in the press conference with the Premier, when they announced that schools would be closed for another 2 weeks, all of the media said, so what are you going to do in those 2 weeks to make sure schools can open permanently? And there was actually no answer. So I run a nonprofit. In nonprofits, you're accountable and you have to have goals. And some people say you have to have goals they call SMART goals, which stands for specific, measurable, attainable, relevant, and time-based. And so we are looking for, and we've made recommendations to the province for setting those goals and being accountable for those goals so that when schools reopen, we have prioritized booster shots for all of the education staff. We've got vaccination centers in schools, so we're getting all of the 5 to 11-year-olds vaccinated we possibly can, because that rate's really low right now. It's like, let's use this time to get the N95 masks, to distribute the funding that was promised last spring, which has still not been distributed at schools. We're in the middle of surveying all the principals in Ontario, and they are writing us the saddest, sort of most pleading kind of messages, saying people need to understand what we're trying to do here. They're commending their staff, but they're really, really worried. They're worried about the well-being of their students, and they're worried that they too, just like us, are hearing what's going to happen next in the media. So they have no time to prepare, they have no time to think it through, and they're not being consulted with. So one of our other things we've been saying for, I don't know, it feels like forever now, is that there should be an education advisory task force. Why aren't we listening to people like Prachi, to principals, councils, the directors of education, teachers, parents, students, together with health experts in health, so that they're all working together to use evidence, expertise, and their experience on the ground to give good advice to the province. And right now, it does feel like, that is the part that's upsetting, is the lack of planning, short or long term. And it feels like it's driven by politics, or by, one person phoning the Premier, or, everybody arguing about what's the, kind of least worst choice or most palatable choice. But we're not thinking, I don't think, about kids and about their future, and really understanding the deep impact of this.
The problem is we're anticipating so many infections, is that even a small proportion of hospitalizations into a small proportion of a large number still translates to a lot of hospitalizations. Now, there is a lot of reassurance in the fact that there are some pretty good data that there is vaccine effectiveness against, especially with the third dose, against hospitalization. So getting the booster or the third dose can reduce the severity. So when we think about severity, we often think about hospitalization, critical illness, and death. So that can be reduced substantially. numbers are a little bit variable, but somewhere in the realm of 75 to even up to 88% in one UK study. So that's really reassuring. And part of that, even though there is less neutralizing or lower concentrations of neutralizing antibodies, that's just one arm of the immune system. So there's another arm called cellular immunity. And it does look like there are some data in the last week, 2 weeks, everything's coming out so quickly now, that shows that T-cell immunity is still pretty robust. So that potentially may be why we're seeing less severity. There's also a study from Europe that shows that it can, even though I agree with Dr. Morris that, this is not, vaccination does not confer sterilizing immunity. There's always a chance that you will transmit, but the reduction in household transmissions is substantial enough that it could play in a really important part in at least blunting some of the transmission, especially with close contacts, such as households.
And let me do this follow-up with you. Is it still the case, as it was with previous variants, that there is a disproportionate number of people in hospital and in intensive care units who have yet to be vaccinated? Is that true?
That is correct. So unvaccinated or partially vaccinated. And one thing we need to bear in mind is that our definition of fully vaccinated is also going to change. And I think we're more likely to adopt terminology going forward, maybe calling, for example, third doses updated vaccines, because I don't think we're done yet. I think we need to prepare ourselves and socialize the idea that ongoing vaccination will be a reality here. And as many people know, some of the vaccine manufacturers are looking at developing and have already developed and are testing Omicron-specific vaccines. We just don't quite know yet what the triggers will be to roll those out. I think we have a lot of work to do in that regard.
Robert, let me circle back to you. And again, I want to go back to the education angle here, because it was only last Thursday that the medical officer of health for the province of Ontario took to the microphones and said, we may need to start the school year a couple of days late, but basically it's all systems go and you're not going to have to put your kids through online learning again. It was only 4 days later that they completely changed their position on this and said, okay, things have changed. 2 weeks now, we need a real circuit breaker here. Can you get us inside that cabinet room and tell us what obviously transpired on Sunday evening when they were having their meeting that resulted in such a different position emerging from that meeting than from the week before?
Steve, I think what happened on the Sunday is that the Premier was shown some new modeling, and I would take all of the modeling with a grain of salt, just because the best, indicator of future behavior is past behavior. And we know that the modeling projections dating back to April 2020 have always been so wide ranging that we don't really know. Are there going to be 10 cases today? Are there going to be 10,000 cases today? At a certain point, it becomes really, really difficult to figure it out. But anyway, I gather that he was shown these projections that 1% of Omicron patients could end up in hospitals, and that as Dr. Mubaraka was saying, it would swamp even 1%, a huge number would be very, very difficult for the health system to cope with. Now, I don't know where that 1% number came from as we do this taping, Steve. I'm trying to find out. But I haven't seen that in any of the studies that we've looked at from Europe and South Africa. So I don't know if it's 1% or if it's 0.1%, but whatever. He was worried enough that he went to the cabinet and said, look, this is what's going to happen, and we have to close schools. But the problem with closing schools is there's a cascading effect that comes from that, for childcare, for the kids themselves, because I think the mental health of our children is the thing that I'm worried about as a parent. What's it going to be like for them after the pandemic? I mean, how are they going to cope? Online learning, and teachers and students and school boards have done a great job coping, I think, but it's not the same as an in-classroom, in-person experience that we all enjoyed when we were in school. And I think that's something that we really need to worry about. And I know that the Tories are very worried about the political ramifications, because parents are upset about this. They're upset that they got told one thing on Thursday, and then the following Monday they got told the complete opposite. And now when they say, oh, it's going to be January 17th that schools might reopen, I don't think anyone believes that that's going to happen because Omicron numbers are still going to be going up, presumably. I mean, Dr. Moore suggested that yesterday that it would hopefully taper off by the end of January, which would be fantastic if that's the case. But that doesn't mean schools are reopening on January 17th if it's still rising, you would think.
Well, let me go to Dr. Morris on that. Obviously, the Premier of Ontario is making decisions along with his cabinet based on the modeling numbers that he's getting from his public health experts. I guess the question I have for you is, how much faith should we have in those modeling numbers upon which these important decisions are being made?
It's a great question. I think modeling at this point in time is very difficult. Even at the best of times, with the best of information that we have, it's very difficult. But the difference that we have in this situation is we are facing Omicron for the first time in, I guess, the planet's history at the same time as other jurisdictions have. Previously, we were learning from other jurisdictions. So we're learning in real time the behavior of Omicron in a manner that we didn't face, for example, with the first wave or really any of the other waves, including Delta. So whether it's 1%, 0.1%, more or less, these are clearly going to be just guesstimates.
One of the most interesting things I learned from your book is that there's, I guess, an assumption that QAnon supporters must be overwhelmingly uneducated, overwhelmingly rural, overwhelmingly out of touch with reality. But in fact, your book paints a very different kind of a picture of who's in QAnon. You want to help us with that?
This perhaps was one of the things that were surprising, but Sophia and I have both studied terrorist organizations, between the two of us probably for 50 years. And so I guess I should have known better. I think part of what I was thinking is you had sort of this poor white uneducated class. Remember, President Trump once said, "I love the uneducated," because of course the uneducated voted for him. One of the things that became clear is that a lot of women in particular who believed in QAnon were women who were successful. They were business owners. One woman even had a master's degree from Harvard University. And so this is really not sort of the stereotypical, low-hanging fruit. And again, you can make a similarity to many of the terrorist groups, that it wasn't only uneducated ex-convicts who joined ISIS. You had people who were doctors or lawyers or engineers. And so I think that it's important that we understand that, first of all, there's no profile for a terrorist, and there's no one profile for someone who believes in QAnon. But there isn't even a political profile, because when the Washington Post last year, around the time of the insurrection or the failed insurrection, did a survey, what they found was 6% of people who believe that there is a blood-drinking cabal run by Democrats and Hollywood elites trying to undermine Trump, 6% of those people that said yes identified as Democrats. So we may even see that there are people who are not just Republicans that support this idea, although it is sort of an uneven, it's disproportionate. It's probably around 30 to 33% of Republicans also subscribe to many of the most insane ideas of QAnon.
And why would it appeal, in your view, to so many women?
I think that QAnon was very capable, whoever was running this, and Jim Swartzen, for example, thinks it's a psychological operation. They were very adept at making people, and particularly women, feel that this was the only way that they could save the children. So in 2020, there was a hashtag campaign, #SaveTheChildren, that was on Facebook, Twitter, and Instagram. And what this did was it pulled in a lot of women. And the question that QAnon was asking is, do you want to save the children? And the answer for most women is always going to be yes. But remember, Steve, I also study ISIS. And that is exactly the way that ISIS appealed to women. Did you want to save the orphans in Syria? So I think what this does is it appeals to women on a very basic level, but it also pulls people in, not because you're some white racist, I hate the Jews, I hate people of color, and so you join QAnon. It's bringing in people who think that they're coming from a place of altruism. I actually joined QAnon and fell down the rabbit hole because I was trying to help people. I really was worried about trafficking. I couldn't believe what was going on with Weinstein and Epstein and Woody Allen and all these horrible people in Hollywood. And so they take a tiny grain of truth, which is what's going to pull in an educated person. But then once you get pulled down the rabbit hole, the consumption of the QAnon material and the propaganda has this effect of convincing you that it's worse than you ever thought, that the conspiracy runs deeper than you ever believed. And so because I'm on their channels and I'm on Telegram monitoring what they say, I see what they see. And you know what? It's really traumatizing. It creates an echo chamber of radicalization that we've seen with jihadi groups and we've seen with racist white nationalist groups.
And that's just some of what we covered this week on The Agenda. For more, including the full conversations, you can visit our website, tvo.org, our YouTube channel at youtube.com/theagenda, or our Twitter feed, twitter.com/theagenda. And that's it for this Friday, January 7th, 2022. Monday, can people still reasonably believe in progress and a better tomorrow? We'll consider that. I'm Nam Kiwanuka. Thank you for watching TVO and for joining us online at tvo.org. Have a great weekend, and Steve will see you again on Monday.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism. Ontario Hubs are made possible by the Barry and Laurie Green Family Charitable Trust and Goldie Feldman.